I'm Dr. Chong, a podiatrist. I treat ankle, foot, and some leg issues. And I'm located at 3838 California Street. And I've been in practice over 25 years. Flat feet is basically a flat arch, low arches. It's an arch that doesn't have stable joints. And so when the joints are not stable, then the arches get out of alignment. And then this alignment affects the other joints in the foot. With the flat feet, it can also cause the ankles to roll in, and so you can get a sprained ankle. Often this occurs when one is young, one is born, often with flat feet. And often there's no pain and no problems, but it should be treated since later on one can get knee or back problems. One of the main treatments is that of custom orthotics for the flat feet because they help support the arches and reposition the joints, which is what happens when you're walking and standing, and they can also help the heels to get straight. And so for flat feet, I often recommend very stable, supportive shoes for this. No brand in particular. It's very, very hard to say, until I see the patient. I will often assess their condition, the type of flat feet, the cause, and we discuss this usually in person, and I usually at that point give some shoe recommendations. I have a handout and so forth. I recommend stretching also for heel pain, flat foot pain, high arch pain. If you have difficulty doing these on your own, I can refer you to physical therapy. So this diagram shows heel and arch pain. We just talked about flat feet, which is the same as low arches right here. This is a more normal arch, and this is a high arch. And both flat arches and high arches can cause heel pain. So another common condition is that of heel pain. And you're probably wondering when this happens, and it's usually in very active people and those with high arches and flat arches or flat feet, which we just talked about. And it usually occurs in the morning when one gets up and stands up from getting out of bed, and or after you're resting, sitting down for a while. And often occurs at the end of the day when you're on your feet all day. And so what are some of the causes of this? It's usually inflamed tendons under the feet, also inflamed bursa or different tissues in the heel. Often the nerves can get trapped in the heel. Some other conditions are being overweight. The fat pad or fat beneath the foot can also thin out as you get older. Also, poor foot structure and a misalignment of the way you walk, and just genetics, what you're born with, what your parents had. So those are the common causes of the heel pain related to flat feet, and again, high arches as well. This is showing an x-ray of a normal heel. This is showing an x-ray with a bone spur. Sometimes a bone spur can cause heel pain, but it's usually just the tissue underneath the foot that's causing the irritation on the bottom of the feet, the flat feet, or the high arch feet, and also at the heel. Some of the common treatments include wearing correct shoes, padding in the heel and or the arches. Sometimes I give shots, cortisone, to the heel. I often prescribe pain medications. I give a handout on stretching, applying ice and heat, and sometimes contrast baths. Also, I will sometimes tape the foot, and I usually start out recommending inserts from the store. However, if none of these things work, then I do recommend the custom inserts or orthotics because they help with the pore structure and mechanics. Usually surgery is left to the very end if nothing else helps, if any of the conservative treatments I just talked about don't help. So that's heel pain in relationship to low arches or flat feet. Another very common problem is fungus in the nail. And basically it gets between the nail and under the nail, causing the nail to get thicker, grow abnormally, including a curved or what we call ingrown toenail. So basically the nail changes color It might have a bad smell. And again, it can get thicker and cause the nail to grow curved and lift off and get very painful. So how does the nail get this way? Usually it's from damage from injury, and that includes poor shoes causing pressure onto the nail. And also it's very common in those who are older and in those with health problems like diabetes, anybody with poor circulation, athlete's foot, and sweaty feet. Those are very common causes of the nail getting kind of odd looking, or patients say they look kind of funky. Well, usually patients come in because they don't like the way it looks. They want it taken care of. Also, a very practical reason is for me to provide them pain relief, because sometimes the fungus toenails, like I mentioned, can get painful and curved. And then if you just leave the nails and if you don't do any treatment, what can happen? Like I mentioned, you can get pain if you don't have any pain. And you might get redness from the toenail itself because it's pushing up on the underlying toe. Also, you can get redness at the end of the bone underneath the toe. It also decreases the chance of getting another kind of an infection, such as a bacterial infection, and it can prevent the nail from getting injured, meaning it can prevent the nail from just falling off or getting pulled off. So those are important reasons to get it treated. And it should be treated in patients with diabetes, patients with a nerve condition. They often have no feeling in the feet. Also patients with poor circulation. This is to prevent more other problems, like I said, like a bacterial infection or further injury. So the main way to treat this is that of shortening the nails and thinning them. Also, there are medications that one can either apply to the nail or take by mouth. This is treated to prevent the spreading of the fungus to the other nails, if not all the nails have fungus in them. Some other treatments also include temporarily removing the nail or permanently removing the nail. Here's some diagrams of toenail fungus. It is very challenging to get rid of, so this is just over some time. And then here's the next one. It just takes it's a long process. So basically, corns and calluses are a thickening of skin due to pressure, and usually over or under a bony prominence. You know, a bone that stands out more, is more prominent basically. But they are usually at the top of the toes, in between the toes, and beneath the foot, usually at the ball of the foot. So the treatment consists usually of changing to different shoes, padding, and removal of the corn callus. However, I don't recommend the medication that you can apply from the drugstore because those can cause infections. Same with the pads with the medicines. I don't recommend those as well because they can cause infections, especially with people who are diabetic and have poor circulation. The reason I don't recommend them because they often cause more pain, they don't remove the corn callus, and they can often cause an infection or a hole in the skin underneath the corn callus. It's very important to treat in patients with diabetes, patients on a blood thinner, patients with poor circulation, patients with no feeling in the feet. The reason again is because you can get an infection or an underlying open wound in the skin. The skin can open up. And often these are confused with warts, which is a virus in the skin. And it's very hard for a patient and even primary care doctors to tell the difference. So I do recommend that you come see me because I can best tell you what it is, whether or not it's a wart or a corn or callus. And so some treatments are just, like I mentioned, basically just removing it. It's very simple. It's usually pain-free. And I recommend this kind of treatment every 2-3 months. And I also recommend applying a non-medicated pad, maybe an insert if they keep coming back. So those are the main treatments. So here's some samples of a corn and callus. Again, a corn is the top of the toe, and it's just thickening of skin. And here it's shown on the foot here. It's a soft buildup of skin. And then a callus is thickening of skin as well, but it's usually on the bottom of the foot. And here's an example of what we call a callus and this is the ball of the foot. So diabetic socks, they're loose-fitting socks and they don't bind. So they're not tight, they prevent skin irritation, and they also provide protection. For the most part, they pull moisture away from the feet so that sweat can evaporate so that there's less risk of getting a fungus infection. Also, they can prevent smells or odors. Hence, they allow for the feet to be drier. They usually are seamless. So not having seams along the toes and the tops of the socks prevent rubbing and blisters. And the concern about blisters and rubbing is that you can get open wounds and ulcers. And these are things you don't want to get if you have what we call neuropathy or no feeling in the feet, or if you have high blood pressure. The other good thing about diabetic socks is that they're made out of soft kind of yarns. Often they're made out of bamboo and wool kind of yarns. And these kind of materials are antimicrobial, so they prevent infections, and they also are not harsh on the skin, and they don't cause friction, which again can lead to rubbing and blisters and open wounds and ulcers. The other advantage of diabetic socks are that they usually stay up without squeezing the calves or causing decrease of the blood to flow. So that's important too. And another feature of diabetic socks, in addition to being antimicrobial, they're antifungal. So that means they have the ability of preventing infection and fungus or athlete's foot in the skin and in the toenails. And these are the kind of properties in this kind of sock. They usually have silver or copper, which are both antimicrobial and antifungal. Another feature of diabetic socks are that they have padding. They have extra padding, usually on the pads of the feet and the soles of the feet. And this alone can stop injuries from occurring. So they're protective as well. So in general, I do recommend them. There's a lot of features that I just went over that are very helpful. They keep moisture out of the feet. They don't have seams. They're made of soft yarns, and they stay up without falling down. Another good feature of diabetic socks is that they're usually white color, so that if you see any drainage of wounds, that is helpful because often diabetics can't feel any wounds or openings in the feet. So just being able to see blood on the socks is helpful so that you know to go to a doctor for treatment. And again, they're antimicrobial, antifungal, and they have padding. So those are the pluses of wearing them, and I do highly recommend them for diabetics, whether you're pre-diabetic or you have full-blown diabetes. Oh, that's a good question. No, they're readily available at stores, medical supply stores, on the internet, of course. So you don't need a prescription. And for the most part, if you do have a prescription, it's not going to be covered by insurance. There are two prescription ones. There's one that's been out for years. It's typically covered by insurance, but it typically is not effective at all. I've had patients use it for many years, and then they come to me saying it hasn't worked. I've been putting it on every day, removing it weekly. It's still not worked. What other treatments are there for topical? There is a newer one out
that's somewhat effective, but most patients don't use it because it's very, very expensive. It's not covered by insurance. So that can be very, very costly for a patient. It's a few $100s. It could be, I think, upward up to $500-800. So I don't usually prescribe it because it's considered a cosmetic treatment. And so for an option, I do carry an antifungal topical in my office, and it's much less expensive at the podiatrist's office. And so it's been very effective, and that's why I carry it here, and it can only be bought at a podiatrist's office. The advantage is not only does it help, but it has a money-back guarantee through the company. So if you're dissatisfied, you call them and they will refund you the money. But I haven't had too many issues where the patient's unhappy with it because it's effective. So for the most part, topical treatment is very challenging in that it takes a lot of effort, meaning you have to put it on twice a day. This one, you have to roughen your top of the nails weekly, and then that allows the medication to get in. And sometimes I have patients come in and I can thin out the nail so that it gets in more effectively. Generally, flat feet, very common, bunions, hammer toes, ingrown toenails. That's often hereditary. Gout can be hereditary. Having high arched feet as well as flat feet. Those are the most common hereditary problems that you get from your parents or your grandparents. So that's kind of a tough question because I've had babies that come in with ingrown toenails and they're just born with it during, when they're in their mother's womb. So that's hard to say, but it varies. Also, there's a variable with fungus toenails. Sometimes fungus itself can cause an ingrown, for an example. But for heel pain, that can occur at any age as well. There's a lot of variables, like the kind of shoes you wear, what kind of activities you do. So for example, if you're wearing high heels and your parents had bunions, wearing high heels is gonna make it come out sooner. So you might have it at age 20 versus age 40 or 50 or 60, depending on the type of shoes you've worn when you were younger. Also the activities you do. If you're more active, these kind of things occur more often and sooner. Let's say you're an athlete or you play a lot of sports when you're a teenager because you're active and you're playing sports all the time and your feet are always sweaty. You're more likely to get athlete's foot, but if you take care of it, you might not even have it when you're older. I think more or less, if you're diabetic or something and your parents have that, then you are more likely to inherit that sooner. So for things like diabetes or gout, you're more than likely to develop that at a sooner age than later age. But then on the other hand, if you're prone to getting diabetes because your parents have had it, if you are very good about your diet and watch what you eat and your exercise, you might not get diabetes at all. So it just really depends on each individual. So I think if your nails are normal, meaning they're not really thick or ingrown, then it shouldn't be an issue as long as you cut them straight across for the most part. So just be careful, don't cut them too short because you can also, cut yourself or cause pain. But if they have fungus, meaning they could be thick, they could be ingrown, they could be hard, they could be painful, then you could cause damage. On the other hand, you might not even be able to use a nail nipper because they're so hard and thick, in which case, then you should see a podiatrist because we do take care of those kind of nails. We can help you cut them. We call it debride the nails. So also, if it's an ingrown toenail, I would not use a nail nipper to trim them because I've seen people that really cut themselves and cause an infection. They try to cut out the ingrown. So that's not a good idea. So in those cases, you could do harm. Same with calluses. I've seen patients that use their nail nippers and try to remove calluses with a nail nipper, and so that's a little dangerous too. As patients get older, it's hard for them to see what they're doing down there, so then I recommend you see a podiatrist. And particularly if you're diabetic, I don't recommend you cut the nails or calluses. Have a podiatrist do it, because of diabetes, they often lose feeling, patient can't reach down, they're in pain. All the above scenarios are things in which you probably should avoid and have a professional podiatrist do it, not a manicurist. Don't go to those nail salons to have the nails cut if you have those kind of toenails.
So as you can see, there are a lot of very common foot problems, and I've only discussed some very common ones I see in my office. There are many types of treatments, including what we discussed, which are most common, but there are some other treatments available for these conditions. So should you need my care, I can help you, as each person is individual, very unique, and therefore the treatment is customized to you. I can provide successful outcomes so that you can feel better. So just wanted to let you know, patients and other doctors are very happy with my results and know I provide great care. Patients also refer to me, as do doctors, again, who refer me their patients. Our office is also readily available, so one can schedule in a timely manner. And we're a very welcoming office. Our location is well known, and we welcome new patients. My office is at 3838 California Street in San Francisco. It's adjacent to the old Children's Hospital, so the cross street is Cherry, and our phone number is 415-386-3338 or 415-386-FEET. Do you have a solution for your foot problems? Comment on this video and please let me know. Thank you.
What did you think of the video? Are there any other topics you want our doctors to talk about? Leave your comments or questions below this video. Like and share this video to spread the knowledge. Check out the related videos on screen if you're interested in learning more. Make sure to subscribe and click the bell to get notified whenever a new video is posted. Thank you for watching.